In today's video, we're going to go over how to split your pants doing hip mobility drills. Just kidding, my favorite hip mobility drills. All right, so why do we need hip mobility drills? First thing that comes to mind are going to be in your post-op patients. So think about your post-op hip labral repair, PAOs, and hip replacements. Although we got to be a little careful with the hip replacement patients, it makes sense after major surgery, you get stiff. We want to restore that range of motion so that we can get back the activities we want to get back to and also improve our outcomes. The second piece is going to be graceful aging. Unfortunately, over the course of time, our bodies tend to get stiffer and stiffer. If we use a nice mobility plan, then we can mitigate a lot of this and maintain our mobility and our function as we age. And the last reason is going to be performance. If I'm an Olympic weightlifter and I can't get deep into the bottom of the squat, it's going to limit the amount of weight I can use on my snatch and my clean and jerk. The other piece is if I have a lacking range of motion in the hips, it may cause the joints above and below to move too much. So if I have a patient that has low back pain, and let's say they're a golfer, they don't move well through the hips, it makes sense I put a little more stress on the spine. So we can use these hip mobility drills on our patients that are lacking range of motion from a rehab perspective, but also for a future injury prevention standpoint. And lastly, if we get more range, we can probably hit the ball a little bit further. So in today's video, we're gonna go over my favorite hip mobility drills I like to use with my patients. What's going on, guys? My name is Dan Pope from Fitness Pain Free. I'm a physical therapist and a strength coach. We've helped to make thousands of incredible coaches and clinicians for online courses, communities, and mentoring programs. Goal of today's video is to make you 1% better. All right, so what methods out there are there for improving range of motion? Well, there's a lot of them. You have stretching, and there's all different types. You have static stretching, where you're holding your stretch for a period of time. You have dynamic stretching, which you're stretching with movement. You have ballistic stretching, very similar to dynamic. You also have things like PNF, contract, relax. You can also do weighted stretching, which is essentially using a weight to go through a full range of motion, get a nice big stretch at the end, and come right back up again. Now, what's best? Well, generally speaking, this is a big topic for another day. But I like to use static stretching. The big reason is that we have good research to show this method of stretching tends to outperform other types of stretching. And the other type of range of motion mobility work that I like to do is going to be weighted stretching. Essentially, using a weight, slowly going down during the eccentric portion of a lift, getting a full stretch at the very bottom of the range of motion. Now, why do I like weighted stretching? So, research generally shows it's about as effective as static stretching, which is a really good thing. The other piece is that not only you're building range of motion, but you're building a little bit of strength and hypertrophy by working into these end ranges, which is really nice for your athletes. So can you foam roll? Can you do contract relax? Of course you can. But if you're limited with time, I would stick to weighted stretches first, and I would add in some static stretches afterwards. All right, first we're gonna go over improving hip extension, or basically the ability for your leg to go behind you. The first stretch I like to do is called a true hip flexor stretch. So I'm gonna be into a half kneeling position. And from here, you can see my belt line, all yellow. I'm gonna try to do a posterior pelvic tilt. The reason why I'm doing a posterior pelvic tilt, because that will extend the hip. When folks do this stretch, sometimes all they do is extend from the spine. We want to get more mobility coming from the hip. So first step is going to be posterior pelvic tilt. Once you have this posterior pelvic tilt, like to brace in the core and lean forward so you have a nice strong pull in the front of the hip, just like so. Next, we have a slider hip extension drill. So essentially I have a furniture slider under my knee and under my foot. On the same split pelvis position right here, I have a box or something stable in front of me. I'm gonna do a posterior pelvic tilt. I'm gonna hold on to this box, maintain my core position, and slide backwards with my knee as well as my foot. And what you'll see is I'm getting into more and more hip extension, and this lead side leg will posteriorly pelvic tilt me so that I'll get more hip extension stretch, not a whole bunch of lumbar extension. Now, I can go all the way back, and I can treat this as a static stretch and hold it, or I can do this a bit more dynamically and allow my hip flexors to control me eccentrically to a full stretch and come right back again. Turn this more into a weighted stretch. Next, we have a rear foot elevated split squat. This is more of a weighted stretch with the weight of your body weight. So I want to get into my split squat position. And from here, I want to go first into a posteriorly tilted pelvic position. And I'm going to descend down slowly, starting to get a full stretch of my quad, as well as the front of the hip at the very bottom. Hold that for a second, come right back up again. Now this stretch is going to be a little bit more for your rectus femoris and less the front of the hip, maybe the psoas, but equally good stretch and a good one to add into your program. Next, we're gonna focus on hip flexion, or essentially bending the hip up, just like so. This is a slider posterior hip stretch. I'll go over this stretch with a couple angles just because it's a little tricky to get. So you're gonna need yourself a slider, and from here, I'm gonna focus on my left side hip. The slider is gonna go on my right foot. So from the side, what I'm gonna do is reach back across my body and slide backwards and to the side. Another thing I'm focusing on is trying to drop this hip down towards the floor as I go. So reaching back, dropping the hip. To increase the stretch, I can take my right side arm, drop the elbow down towards the floor, and I'm trying to turn my body towards my downside leg, just like so. Let me show you this angle here. Straight back, to the side, sitting back, dropping my hip, right side elbow down towards the floor. Let's show you from this angle. Reaching across my body, just like so, down and back, dropping my hip and my elbow down to the floor. You should feel a big stretch in the back side of the hip. You should feel a little bit like your femur or your thigh bone is about to poke out the back side of your hip. And with this stretch, we can hold this statically for a period of time, or we can go a little more dynamically and try to control the motion with your hip. And in that way, I would classify it as a weighted stretch. So essentially, we're gonna take this kettlebell, bring it up here. The weight gives us a little extra force to push us down into a nice stretch, descending slowly, and then pausing at the very bottom, trying to get as deep as you can. Let the weight push you down there, hold it for a second or so, come right all the way back to the top, and then just repeat for repetitions. If we wanna make this a little bit more of a stretch for adductors, you go a little bit wider, add a little extra toe out. You'll notice my knees are getting really wide, right? I get a nice stretch in the adductors. I can also get my elbows to push the knees out wide, adding even greater stretch. I can kind of mess around with going side to side, left to right. They would call this a pry squat. Hold for a second in the deep stretch, come all the way back to the top, and that's it. To work on external rotation, we have a variety of options. One of the easiest ways to work into this is going to be a 90-90 position, stretching into external rotation. So essentially it's called 90-90 because I'm bent at 90 degrees at the knee and the hip on both sides here. And all I'm gonna do is bring my chest over top of my lead leg, and as I descend, I automatically feel a nice pull in that hip here. To increase the intensity, I can try to do an anterior pelvic tilt, get my chest up and lean forward. And you should feel a nice pull on the back side of the hip there. I'm also a big fan of the pigeon pose, particularly a pigeon pose on top of a bench. So doing the pigeon pose on the bench will take out the rear leg, so I'm no longer working on hip extension there, and all the focus is gonna be on hip external rotation. So essentially, you're taking your foot, placing it on a bench. From here, if you can, you're trying to get your knee flat. And if I want to increase the intensity of the stretch, all I have to do is sink down towards the floor or lean my chest forward like I was doing in the 90-90 stretch. For some folks, it doesn't feel phenomenal on the knee, and one of the things you can do is you can elevate an incline bench and put your foot across, perform the same stretch going straight down. If I want to add a little bit of extra weight, I certainly can. And then I take this weight here and I can sink down towards the floor, full stretch in the very bottom position, come right back up again, right down for repetitions, turning this into a weighted stretch. If you guys like the videos I'm putting out, I would really appreciate if you like this video and subscribe to the channel. It helps me tremendously. All right, next we're gonna chat about hip internal rotation range of motion. Now this next drill, unfortunately, I stole from a patient. They stole from another physical therapist, so I apologize. We have no idea whose exercise we're stealing. But essentially, you lie on your side with an ankle weight on your leg, on the leg you wanna mobilize. And from here, we wanna have our legs close to the edge of the table. Top side leg, we're going to bend up and pin this down. The second leg, I'm gonna bend the knee right here. And what you'll see is the weight is gonna pull me into internal rotation range of motion. Now, a couple things I can do here. I can let my leg hang off the edge and just hold this for a period of time, getting a stretch on my bottom side leg into internal rotation, or I can perform repetitions. So essentially, a weighted stretch, start here in external rotation, slow control to the very end range, nice stretch at the very bottom, and just repeat for reps. Really solid exercise. Next, we have 90-90 rotations. Now, this is the same as your typical 90-90 rotation for external rotation. We're trying to stretch over this lead leg here. We're actually trying to stretch the trail leg right here, okay? And you have to be a little careful because this can be provocative and aggravated hips. But essentially, I'm sitting here, 90 degrees at the knee and the hip, 90 degrees at the knee and the hip, just like so. And what I want to do is lean to my side. This is going to put my hip in a more neutral position, so I'm not bent into horizontal abduction so much. And from here, I'm going to rotate backwards. And what I'm doing is I'm mobilizing my hip into internal rotation, range of motion. And I can do repetitions, so basically a dynamic stretch where I'm going slowly and stretching into end range. Again, I want to be cautious because this can be aggravating, or I can hold for time performing a static stretch. Now, this stretch is a little bit different than other stretches because oftentimes it doesn't feel like a muscular stretch. It feels like something different, and that's probably because it is. So when we go into this position, we might be stretching a couple different things. The first of which is going to be the hip capsule, with a series of ligaments that surrounds the hip joint, so I might be stretching those. The other piece is that a lot of folks have a bump on their femoral neck called a cam morphology, and if folks have a cam morphology, they have more restriction into internal rotation. And that restriction is coming from bone. So if I'm wailing on this stretch right here, not only might I not gain any range of motion, I may end up creating some symptoms within the hip. So just be cautious with this stretch. Cable hip internal rotation stretch. So I'm basically using a cable here. I have a light to a moderate load. From here, grab those with two hands. We're gonna perform a basic chop exercise. So the difference between this chop and other chops, we're focusing on hip internal rotation on this leg right here. So as this weight pulls me across my body, I'm twisting, setting my hips back, getting a great mobilization for this side hip. Just come straight through, perform a few repetitions as a weighted stretch, trying to sink as deep as I can into the hip and come right through. I can also treat this as a static stretch, so essentially rotating as far as I can and then holding this stretch statically for a few minutes, right? The other piece, if I want to increase the internal rotation of the hip, I can take this inside leg and turn my toe in a little bit. Now I'm biased into a little bit of internal rotation, and as I come across my body, there's even more internal rotation going on. And again, I can either perform repetitions just like so, or I can sink into this stretch and hold for time. Next, we'll focus on improving hip ABDuction by stretching the adductors or groin muscles. My favorite way to start this is by using sliders. We take these sliders and we put these on your knees, and they will slide out to the side, allowing us to get a really nice stretch of the adductors. I can also take my hands and put them on the floor. If I want to try and intensify this stretch, I can very easily take my feet, put them flat against the wall, and from here, I'm going to reach my knees out to the side, but also push myself back towards the wall for a nice deep stretch. Now, if I can't get the mobilization I want, I'll take something heavy here that I can push against this kettlebell as I reach my knees out to the side, get a nice intense stretch of the adductors. Now we can treat this as a static stretch, so basically just holding for time, or you can make this more dynamic, turn it into more of a weighted stretch by trying to go into adduction, then sinking down and controlling this motion with your adductors into an end range stretch, holding this for a second or two, and then coming right back up, and then back down into the stretch. So two good options. Another thing to consider is that some of your adductors cross over the knee and some do not. The big muscle I'm talking about is mainly just the gracilis. So if I'm doing one of these exercises against the wall, the frog position, I'm not stretching the gracilis as much because when I have the knee bent, then the gracilis is slacked. So if I want to stretch that specifically, I could take my foot, I could put on a slider, and then from here, I just reach my foot out to the side as far as I can. Usually a nice deep stretch, my trail side leg just like this. If I want to intensify that stretch, I can also sit my butt towards my heels, and that increases the stretch. So again, I can treat this statically, holding it for a period of time, or I can go a little more dynamically and try to control the slide out to the side with my adductor muscles and pulling right back in again. So this is a bit of a dynamic stretch, but we're also treating this as a weighted stretch because I'm trying to control the motion with my adductors. Next, we'll talk about mobilizing into hip ABDuction, which is essentially coming across your body, just like so. Where you see this more functionally is where folks are playing a sport and they have to drop into their hip. So if I'm staying on one leg and I drop the other side hip down, I'm going to ABDuction. If I lift my hip up into the ceiling, right, that's more hip ABDuction, more commonly known as a hip hike. If I want to increase the challenge, make this a weighted stretch, all I have to do is grab a weight. And from here, I can balance on one leg, I can drop into end range hip ABDuction, get a nice stretch, and pull right back out again. I can also treat this as a static stretch, essentially holding on to something for balance, dropping the hip, and holding for a period of time. If this is too challenging for the patient you have in front of you, you can very easily hold on to something, just like so, and now drop one hip and use your hands to assist you back up if need be. Another effective way we can work into hip ABDuction is through airplane variations. So essentially, if I'm staying on one leg and I go into a single-legged deadlift position, you can go into as much or as little hip flexion as you want. From here, I'm gonna drop my opposite side hip down towards the floor. It's a little tough to see from this angle. What I'm trying to do is take my toe and face it across my body as much as possible. I'm dropping this hip straight down. And usually I like to use some sort of support just because it's really tough to keep your balance. You're trying to stretch and all you're doing is wobbling around because your balance is so bad. We're probably not working on your mobility. If I want to try to increase the amount of stretch that I have within the hip, I can easily just use a weight. So if I'm balancing on one leg just like so, I drop to my single-legged deadlift, I use the weight to sink me into more hip ABDuction and right back up again. I'm performing a weighted stretch. If I want to try to hold this for a period of time, I'm getting a static stretch. And the other thing we can do is I can take this weight and I can take it to the opposite side hand, swing it around behind my back, and from here the weight is going to pull me into more hip ABDuction, increasing that stretch. And I can perform my hip airplanes just like so. All right, so how long should you be stretching each week? So Ingram et al. In 2025 showed that the best duration to maximize your long-term improvements in mobility were 10 minutes per week. So essentially, if you did less than 10 minutes, you didn't get the full effect. But if you did over 10 minutes per week, then you actually didn't get any greater effect than just doing 10 minutes. Now, how can you split this up? It's kind of up to you. 2 sets of 5 minutes done Tuesday and Thursday, or maybe 5 days per week of 2 minutes. Doesn't seem to matter too much as long as you're getting those 10 minutes. So how about weighted stretching? So Elizada in 2023 conducted a systematic review to try to get an idea of what the best set and rep parameters were for improving range of motion via weighted stretching. And basically what they found is that there's a large variety of set and rep parameters that works. We don't really have all the research we need to figure out what the best loads are, the sets, the reps, frequencies, so on and so forth. But generally speaking, they recommended somewhere between 40 and 110% of your 1 rep max, performing somewhere between 1 and 3 sets for somewhere between 5 and 10 repetitions. I know for me, I tend to use that minimum effective dose. So essentially I'm doing 1 set of somewhere between 8 and 10 repetitions, generally with a moderate load, somewhere between 2 and 3 times per week. All right, so you know how to do mobility drills for the hip, but you probably want some strengthening exercises. And I have the video for you. In the corner, I'll leave a link to a video on my favorite strengthening exercises for the hip flexors. We'll also go over a few weighted stretches. So if you're looking for mobility in those hip flexors, these will do it for you. Go and click on that link and I'll see you in that video.